Hello, in this video, I'm going to talk about functional anatomy of gluteus maximus and hamstrings. So first, some basic anatomy. Gluteus maximus is our largest gluteal muscle and also the most superficial. It crosses all the way from the coccyx and the sacrum and the posterior iliac crest. That's where it originates. And then it goes all the way across and inserts on the gluteal tuberosity and blends into the iliotibial tract that runs down the side of the leg. So its actions are to extend, abduct, and laterally rotate the hip. The hamstrings originate on the ischial tuberosity. So if we look in this top picture, this big bump here is the ischial tuberosity. So all three heads of the hamstrings originate there, and then they go down the posterior thigh and then split in their insertion. So two of the muscles go to the medial side of the knee, and the other muscle goes to the lateral side of the knee. So gluteus maximus only crosses and acts on the hip, whereas hamstrings cross the hip and the knee and therefore has actions at both. So the hamstrings are the major knee flexors, but they also extend the hip and medially rotate and laterally rotate the tibia. So the different muscles, depending on which side they insert on, will have minor action in medial and lateral rotation of the tibia in the knee joint. Okay, so the hamstrings, because they are biarticular, they cross the hips and the knees, we have to consider passive and active insufficiency. I link to a video in the description if you need a review on these two concepts. So passive insufficiency occurs when a muscle cannot lengthen to a great enough extent to allow full range of motion at both of its joints at the same time. So passive insufficiency of the hamstrings occurs when we have hip flexion and knee extension simultaneously. Okay, so the hamstrings extend the hip and flex the knee. So when we have the opposite of those actions happening simultaneously, there's a limit to how much range of motion we get. So think about if you're doing a hamstring stretch, think about laying on your back and maybe somebody is partner assisted and they're pushing your leg up towards you. If your knee is extended, that limits how much hip flexion you'll get. If you flex the knee, now suddenly the hip can flex much further. And that's because when both the hip is flexed and the knee is extended, we have a limit in how much range of motion we get simultaneously at the two. And that's passive insufficiency. Active insufficiency is the opposite problem when the muscle cannot shorten to a great enough extent to be able to cause the two actions at the same time. So in the case of the hamstrings, that would be simultaneous hip hyperextension and knee flexion at the same time. Okay, so if we've got the hip in a hyperextended position, that is going to limit how much knee flexion we're able to achieve or how much strength we're able to put into that knee flexion. Now, the hamstrings are at an advantage when we have simultaneous hip and knee extension at the same time. So think about coming up from a squat. So in that case, we are extending the knees. So the hamstrings are lengthening at the knees while the hips are extending. So the hamstring is shortening at the hip at the same time. So because it's lengthening at one joint and shortening at the other joint, the muscle is at an advantage in that situation because the overall length of the muscle can remain relatively the same, which is going to optimize the force production in that muscle. So hip extension with knee flexion versus extension. So hip extension while the knees are extended are going to engage the hamstrings at the hip. So for hip extension. Hip extension while the knees are flexed is going to disengage the hamstrings at the hip because the hamstrings won't be able to shorten to a great enough extent to exert tension and force in hip extension because there's too much laxity of the muscle. Like we can't take up that length of the muscle when the knees are flexed. So the hamstrings are already shortened at that joint. So gluteus maximus is the prime mover in hip extension when the knees are flexed. Okay, if the knees are extended, then gluteus maximus and the hamstrings work together in hip extension. And we could debate which one between the two would be the prime mover. It's debatable and probably depends on the activity. But when the knees are flexed, like in a glute bridge like this, like we see in our picture here, then gluteus maximus is the clear prime mover because hamstrings would be experiencing active insufficiency. So because the knees remain flexed here, that means that the hamstrings are in a shortened position at the knee and they don't shorten to a great enough extent to contribute significantly at the hip. So that's why we call this a glute bridge, is because the hamstrings can't be very involved, and we're targeting the glutes here primarily in that hip extension. All right, thanks so much for watching, and I'll see you in the next video.